And now for part 2 of this week's health news briefing. The Dominican Republic warns residents about heat stroke risk. Cuban nurses arrive in Jamaica. Guyana reports no severe COVID-19 cases in recent months. Regional EOC launched by CARPHA. This when we return on this week's episode of Health Across the Islands. Thank you for joining us for part 2 of this week's health news stories. I'm your presenter, Natasha Robinson-Connor. Health authorities in the Dominican Republic are urging residents to take precautions as soaring temperatures increase the risk of heat-related illnesses across the country. The Ministry of Health is warning that prolonged exposure to extreme heat can lead to dehydration, heat exhaustion, and heat stroke, a medical emergency that can become life-threatening if not treated quickly. They are urging older adults, young children, outdoor workers, and people with chronic medical conditions, that is, those who are considered especially vulnerable during these periods of intense heat, to stay inside as much as is possible. Officials are also advising residents to drink plenty of water throughout the day, avoid strenuous outdoor activities during the hottest hours, wear lightweight clothing, and seek shade or air-conditioned spaces whenever possible. They're also reminding the public that symptoms such as dizziness, confusion, rapid heartbeat, or loss of consciousness require immediate medical attention. Health experts say climate change is contributing to more frequent and intense periods of extreme heat throughout the Caribbean, making public awareness and prevention extremely important. While many of the countries in the region struggle with low numbers in its healthcare labor force, Jamaica has welcomed the new group of Cuban nurses. The nurses are expected to support hospitals and health facilities across the island, helping to address staffing shortages while expanding access to essential healthcare services. Health officials say the partnership reflects the long-standing relationship between Jamaica and Cuba in the field of healthcare, and for decades, Cuban medical professionals have played an important role in supporting health systems throughout the Caribbean, particularly during times of increased demand and public health emergencies. And though discontinued recently under long-standing arrangements, new guidelines have been developed and the healthcare workers have been re-engaged. The shortage of healthcare workers across the region has been driven by migration, retirements, and the growing demand for medical services. Officials believe the additional personnel will help reduce pressure on frontline healthcare workers while improving patient care and strengthening the resilience of Jamaica's health system. And for more encouraging news, this time out of Guyana. Health officials say the country has not recorded any severe COVID-19 cases in recent months, a sign that the virus is currently having a much lower impact than during previous waves of the pandemic. According to the Health Minister, Dr. Frank Anthony, while COVID-19 continues to circulate, most reported infections have been mild and have not required hospitalization. Officials credit high levels of population immunity, improved clinical management, and continued surveillance for helping to reduce the severity of infections. Health authorities also continue to monitor new variants and maintain surveillance systems quickly to detect any significant changes in transmission or disease severity. Public health experts say the current situation demonstrates how vaccination, surveillance, and improved treatment have transformed the management of COVID-19, allowing health systems to focus on a broader range of public health priorities. The Caribbean Public Health Agency, better known as CARPHA, has officially launched a regional emergency operations center designed to improve the region's ability to prepare for and respond to public health emergencies. The new center will serve as a central hub for coordinating information, monitoring potential disease threats, and supporting member states during emergencies such as disease outbreaks, hurricanes, earthquakes, and other disasters that can impact public health. CARPHA says that the Emergency Operations Center, the EOC, will strengthen communication amongst Caribbean countries, allowing health officials to share information more quickly, coordinate response efforts, and mobilize technical support when needed. The initiative is also expected to enhance disease surveillance, improve emergency planning, and help countries make faster evidence-based decisions during crises. The launch comes at a time when the Caribbean continues to face increasingly complex public health challenges, including emerging infectious diseases, the health impacts of climate change, and more frequent natural disasters. Regional health leaders say no single country can respond to every emergency alone, making collaboration and information sharing essential to protecting the health of Caribbean populations. Officials believe that the new Emergency Operations Center represents an important investment in regional health security and will help ensure that the Caribbean is better prepared to respond to future public health threats. These are the stories in part 2 of our weekly health news briefing. Have a wonderful week.